Ini sekolah. Loh ni, Richard. Oh. Okey. Kita nak datang sekarang. Woi, kamu apa tu?
Astagfirullahaladzim, Dam.
Dam, kita muda lagi, Dam.
Apa?
Remaja baru, Dam. Kau buat apa ni, Dam? Kau ni teruk lah. Dah, jom ikut kita orang. Dah. Kan? Woi.
흘러갈 뿐이야 사랑해요 고마워요 따뜻하게 나를 안아줘 이 사랑 때문에 나는 살 수 있어.
Assalamualaikum warahmatullahi wabarakatuh. So I'm here to present about how NADA manage drug addiction issues among teenagers in Malaysia. First of all, I would like to introduce about my group members. Started with, my name is Muhammad Adam bin Muhammad Nur Hafizam and my number matric is 2025873268.
My name is Adam Mukris bin Azhar Fikri and my matrix number is 2025894712.
Alright, my name is Muhammad Izrain bin Iskandaria. My matric number is 2025886478.
Hi, my name is Alia Adriana binti Zamri and my matric number is 2025808588.
Hi, I'm Ani Shahida binti Muhammad Zamri. My metric number is 2025285214.
Hi, Assalamualaikum. My name is Alia Najwa binti Abdul Rahim and my metric numbers is 2025809192.
I would like to talk about drug addiction issues among teenagers in Malaysia. This issue mainly involves teenagers aged 11 to 19 years old. According to the National Health and Morbidity Survey, NHMS 2022, around 60,000 Malaysian teenagers are currently using drugs. In addition, about 106,000 teenagers have tried drugs at least once in their lifetime. The survey also shows that 2.8% have used inhalants, 2.3% have used kratom, 1.1% have used marijuana, and have used amphetamine or methamphetamines. This statistics shows that drug use among teenagers is a serious and growing problem in Malaysia. There are several causes of drug addiction among teenagers. First, easy access to drugs makes it easier for teenagers to try them. Second, peer influence plays a major role as teenagers may feel pressured to follow their friends. Besides that, individual or family problems such as stress or lack of parental attention can push teenagers towards drug use. Lastly, social media influence can normalize or promote harmful behaviors. Next, drug addiction also can lead to many negative consequences. Teenagers may experience bad mental health conditions such as anxiety and depression. It can also cause problems at school, including poor academic performance and discipline issues. In addition, drug use can result in changes in behavior, such as aggression or isolation. Most importantly, it can cause serious health problems that may affect them in the long term. This pie chart shows the sources where teenagers get drugs. The largest percentage, 38.4%, shows that teenagers bought drugs directly from someone. Next, 25.1% gave money to someone else to buy drugs for them. About 14.9% stole drugs, while 13.9% got drugs from friends. The remaining 9.7% obtained drugs through other ways. This clearly shows that drugs are easily accessible, especially through friends and social connections.
So So I will explain about the planning stage. The planning is to prevent teenagers from starting drug use through education, outreach, and youth programs. It also focuses on providing early intervention and effective rehabilitation for teenagers already involved in drug use. Besides that, the aim is to reduce the overall rate of drug addiction among teenagers through systematic prevention and control strategies. The plan also helps to raise awareness among teenagers, parents, schools, and communities about the danger of drugs. Lastly, it strengthens the cooperation between government agencies, schools, NGOs, and communities for long-term prevention and support.
In organizing, I will sharing how NADA manage drug addiction issues among teenagers. First, we start with treatment, medication, and rehabilitation division. This division focuses on helping addicts stop drug use and overcome addiction. Treatment and rehabilitation services are based on evidence, best practices, and international standards. Services are delivered through three main settings: institutional-based treatment, community-based treatment, and aftercare programs. For example, rehabilitation at Acute and Care Rehabilitation Centers (CCRC). Teenagers stay at the center for a fixed period to receive medical treatment, counseling, and psychological support. Second, prevention division. Prevention is a long-term strategy to stop individuals from becoming involved in drug abuse. It focuses mainly on teenagers to help them make informed decisions and avoid drugs. The functions of prevention division is to educate the public, especially teenagers, about the abuse of dangerous drugs. Prevention activities include public education, school talks, awareness campaigns, and anti-drug programs. Third, we focus on enforcement and security division. This division focuses on detecting and taking action against teenagers involved in drug abuse. NADA has authority to bring detected drug users to treatment and rehabilitations. NADA enforcement does not focus only on arresting addicts, but also on education, school outreach, drug screening, and data sharing. For youth issues, NADA enforcement does not stand alone, and it often collaborates with the police, school, and the Department of Education.
Next, I would like to explain how NADA making decision to manage drug addiction among teenagers. Firstly, NADA mainly applies non-programmed decision making. This is because drug addiction among teenagers is a complex and unpredictable problem. The pattern of drug abuse changes over time. New types of drugs emerge, and the social factors influencing teenagers are different in each area. Decision making plays an important role in how NADA manages drug addiction issues. Firstly, decision making helps NADA identify priority areas with high drug addiction cases among teenagers. By identifying this high-risk area, NADA can focus its attention and effort on locations that require immediate action rather than spreading resources to teens. Next, NADA examines available alternatives such as prevention programs, early intervention, counseling, and enforcement action. This allows the agency to choose the most appropriate approach depending on severity of the problem. For teenagers, preventive education and early intervention are often prioritized to stop addiction at an early stage. Lastly, NADA reviews changes in working method for the long term to ensure it remains a leading agency in combating drug. This includes improving strategies, strengthening collaboration with communities, and adapting programs to current drug trends. Through continuous evaluation and improvement, NADA can remain effective in addressing drug addiction challenges.
And now, I'm here to explain about controlling. So, controlling means checking whether plans and programs are working properly. First, NADA sets clear strategies and direction plans so everyone knows what needs to be done. Then, programs are monitored to make sure they are effective and achieve their goals. Next, activities are evaluated to ensure they reach the right target groups. Then, this process ensures a comprehensive drug control approach. And finally, the strategies cover prevention, treatment, rehabilitation, and law enforcement. In short, controlling helps NADA improve its programs and ensure success. Now, I want to explain about SWOT. First, the organization has a clear structure through departmentalization. Each department focuses on prevention, treatment, and enforcement, which makes work more organized. Second, there is strong work specialization. Each division has specific roles, so tasks are done more efficiently. Third, treatment, rehabilitation, and aftercare programs are available, especially for teenagers. This helps individuals recover into society. Next, government authority allows NADA to enforce compulsory treatment and supervision. This strengthens control and ensure compliance with drug policies. Lastly, there is good collaboration with schools and communities. This helps increase awareness and prevention at the grassroots levels. This slide shows the weakness of SWOT. First, the enforcement approach may cause fear instead of encouraging voluntary participation. This can make people afraid to seek help. Second, the rehabilitation process is time-consuming and requires long-term commitment. Some individuals may drop out before completing the program. Third, stigma towards drug addicts still exists. The stigma can reduce teenagers' willingness to ask for help. In short, this weakness can limit the effectiveness of drug control efforts. The opportunities of SWOT. First, early intervention programs can prevent teenagers from experimenting with drugs. Next, adopting evidence based on international treatment standards can improve program quality. Then, collaboration with NGOs, parents, and healthcare providers can strengthen prevention and treatment efforts. Lastly, increased school-based prevention programs can directly target teenagers. Okay, so now we move to traits. For the first point, peer pressure and social influence. Sometimes the people we hang out with make us feel like we have to use drugs to be cool or to belong. It's hard to say no when everyone around you is doing it. For the second one, easy access through online platforms. So in the past, you had to find a dealer in person. Now, drugs can be bought with just a few clicks on social media or apps. This makes the temptation much closer and harder to avoid. Thirdly, family problems and lack of supervision. When home is stressful or parents are not around to guide their children, people often look for an escape. Without a strong support system at home, it's much easier to fall into the wrong habits. Lastly, risk of relapse due to negative environments. Even if someone wants to stay clean, being in a bad neighborhood or hanging out with old friends who still use drugs can pull them back in. It is very hard to stay healthy if your environment is toxic.
Okay, now I will explain about the recommendation of AADK. There are a few simple recommendations that AADK can take to improve its program. First, AADK should involve family and community so former drug users continue to get support after completing the program. Second, long-term monitoring is important to reduce relapse and help ex-drug users to stay on the right path. Third, AADK needs to strengthen mental health and counseling service because education also affects a person's mind and emotion. Next, prevention program in school and among young should be improved to stop drug abuse from an early age. Lastly, AADK should update awareness campaigns to address new type of drug and current drug threat. In conclusion, AADK recognize that drug problem continue not because of lack of effort, but because it involves complex social, economic, psychological and criminal factors. Although many prevention and rehabilitation programs have been carried out, long-term success requires a more coordinated and collective approach. Therefore, AADK remain committed to improving its strategy, adapting to new drug threat and working closely with family, community, school, employer, enforcement agency and other government bodies. Through share responsibility, reduce stigma and stronger recovery support, AADK aim to create a more effective and suitable national framework for drug prevention and rehabilitation.